Let me ask you something. Have you ever been exhausted, foggy, gaining weight, anxious, or just not yourself, and your labs came back normal? You were told everything looks fine, but you know it's not. If you're in a high performer, entrepreneur, or woman navigating hormone changes, burnt out can feel like a personal failure. But what if it's not a motivation problem? What if it's a physiology problem? Today, I'm going to explain how integrative and functional medicine uncover the root causes of hormone imbalance, chronic fatigue, gut dysfunction, and stress overload, and why so many people are stuck in survival mode without realizing it. If you ever felt dismissed, confused, or tired of temporary fixes, this conversation is for you. So let's get into it. I'm Dr. Evan Lee Ellis, a licensed integrative primary care physician, which means I'm a licensed primary care, but I approach health differently. I don't just manage symptoms, I look for root causes. Let me show you a little bit of my picture right here. There you go. So I'm also the first generation immigrant for the first in my family to pursue higher education and become a physician. Building my business and building my health happening at the same time. And that journey shaped how I practice medicine today. I work primarily with high performing professionals and a woman, man, stay at home mom, working professional, entrepreneurs, and women navigating hormone changes, burned out, gut issues, and energy crashes, especially when they've been told their labs are normal, but they still don't feel well. My belief is very simple. You can't build a thriving business if your body is constantly in survival mode. And that's what I do. And a little bit that I graduated from Bastyr University in Kenmore, Washington. This is my proud parent right here. Well, you're welcome, mom and dad. Become a famous. And I also pursued a fellowship of FAIHM in California and for the integrative medicine. So why did I choose this path, right? What led me to practice way wasn't just textbook. It was observation. During my training and career early in my time, I saw many capable, intelligent people struggling with chronic fatigue, hormone imbalance, anxiety, gut issues, and being told everything looks fine. I saw women especially being dismissed. I saw entrepreneurs, engineer, work for tech company, normalizing burned out. I saw stress being worn like a badge of honor. The more stress you have, that means you work very good for yourself and very earn high income because you have more stress. And I started asking a different question. What if the problem isn't that people are weak? What if their physiology is overloaded? So, as a founder myself, I felt the pressure, the long hour, the mental load, the responsibility, the constant decision making that leading to decision fatigue. So, and what I realized is this: most high achievers don't need more motivation. They need better support for their nervous system, hormone, and energy system. That's why I chose integrative medicine and go deeper into it, not just superficial, because I didn't really just prescribe and move on. I wanted to understand the full picture, the stress pattern, the gut health, the nutrient status, environmental exposures, hormone rhythms. I wanted to treat the system, not just the symptom. And that's how I practice. So a lot of people would ask, what is actually naturopathic medicine? What is functional medicine? What is all integrative medicine? Those words can use very interchangeably, and they do have a different philosophy in the background. So at its core, it's all about root cause medicine. So let's show you this picture. I'm a licensed as a primary care physician in Washington. That means I can do physical exams, diagnose, order labs, prescribe medications when needed, except for some substance control that were limitation in my scope, and manage both acute and chronic conditions. I love chronic condition. Not to say that I love that you're being sick, but at least I love to help you getting better with the chronic conditions. But the difference is how we think. That's the key. The conventional medicine is often very good at crisis care, infections, emergencies, acute problems. You have all the specialists everywhere you can go to, and we keep referring with each other. And my job is to keep the holistic picture, paperwork, communication to make sure my patient understand what their health is on and what journey they are going through. But when it comes to chronic fatigue or hormone imbalance, gut dysfunction, autoimmune issues, or burnt out, the approach can become very symptom focused. So here's the part that surprises most of my clients. Integrative medicine asks a different question. What is happening? Why it is happening? The word why always stuck in my head because reason. We can't sleep, right? We keep trying to find a word why. Instead of just managing anxiety, we look at a cortisol stress, rhythm, and nutrient deficiency. There are good stress, there are bad stress, but we have to find out, are they all synchronized and work together balanced in the same range? Instead of just managing weight gain, we look for insulin resistance and hormone signaling like ghrelin, leptin, what happens to fasten insulin when you eat, using continuous glucose monitoring to make sure we know exactly what happened in your day. Instead of just treating headaches, we look at the inflammation, gut health, and mitochondria function. That is about energy, power, health for our body. It's a system approach. Think of that way. Your body is not a collection of random symptoms. They're all connected. It's an interconnected network. Hormones, gut, immune system, brain detox pathways, all influencing each other. And my job is to communicate with different specialists and providers so we can like provide that bigger picture for the patients and translate that research and information evidence based in that lay language for the people to understand. So it's not an alternative, it's comprehension. So people would ask, what is your full scope of practice as an integrative care actually look like? So I will tell you how it look like in my practice. First, I provide primary care. What primary care meaning? Acute cases, annual exam, annual pap exam, any type of UTI, sore throat, etc. Then we work up the different level that we will do a deeper physical exams, evaluate acute concern like infection, is it minor illnesses, and help manage the chronic condition. Chronic is anything happen more than 6 weeks, 3 months, and it happens seasonally or revolve every single year. And I'm not separate from primary care, I'm expanding it. And second, I use advanced testing when appropriate, which is specializing testing. And there's where most people get misled about specialty lab. So, for example, if someone is exhausted, but standard labs are normal, we may look deeper at cortisol pattern and hormone signaling. If someone has chronic bloating, diarrhea, constipation that sometimes on and off, brain fog, or inflammation, we may evaluate gut health and more thoroughly and a different, deeper lab to do. If someone is struggling with energy crashes, we look at micronutrient is a dehydration or low food intake, and mitochondrial function and metabolic markers. If someone has persistent symptoms that don't resolve, we may assess environmental exposure, such as mold related mycotoxins or other toxic burdens that we exposed in the past. A house have mold, black, green, yellow, etc. that we never think it actually stay in our body, or even heavy metal that we consume food or exposure to any building that have heavy metal, and also workforce related issue as well when clinically indicated. And the goal is to test that strategically, not just anything, but we have to be strategized what to test because a lot of tests can really build up a lot of financial cost for the clients. So I'm very conscious about that. And then comes the treatment. So I use a combination of targeted herbal medicine, plant medicine, clinical nutrient of vitamins, food, lifestyle change, movement, evidence-based supplementation, IV nutrient therapy when needed, especially when they cannot absorb the nutrient that they intake from food, lifestyle and stress physiology support. Just think of it like what we put in our body, in our mouth. How do we move our body to energize it and digesting things? And how do we think about mental mindset to really help our life to have that big picture of everything? So you can tell a lot of things is personalized to the specific individual. And this is not one size fits all. I know there's a lot of plan, for example, protocol, you follow this. However, everyone have different level, everyone have different weight, different height. So therefore their BMI will approach with different direction. So it's a system-based roadmap tailored to the individual. And the most important part, we take time. We take time to listen, we take time to investigate, and we take time to realize which treatment plan work for you. So a lot of patients, I would say that this may not work for a lot of people who want quick fixes, who want to come in and say, hey, can I have a weight loss pill? And that work? I understand advertisement will prone us to think of that direction. But when you think about long-term health, how much we get sick is equal to how long it takes to heal, and it's called healing crisis. We get worse before we get better. And that is one of the philosophy in naturopathic medicine. The initial appointment are typically 60 to 90 minutes. We map out a full health timeline. We connect the dots. We build plan to make sure that it makes sense long term. Because the last thing I want to do is you come home, you have no idea what to do, and you stop seeing me. That is waste your time and waste our critical thinking. So I would love anyone who come in, research very deeply, talk to the provider, make sure you match and understanding the way that it works, and be patient, because if you don't feel patient for yourself, your body won't feel patient for yourself too. So when it asks for that, that means that your body will understand, listen to that, and take time to take notes of what your body is telling you. And because sustainable health requires strategy, I like the word strategy, just like sustainable business, right? You need to have a right strategy. You can do everything in the wrong order. You think the business go right? So do things in the right order. It will help your body to move in the right direction. And if this is helpful, consider subscribing. I share education on hormone health, burnt out, and root cause medicine regularly. So, what does a comprehensive experience look like? And what does this actually feel like to work with me? A comprehensive visit in my practice is very different from what most people are used to. Our initial appointment is typically 60 to 90 minutes. And we don't just talk about current symptoms, we gather them as well, and we branch out. We map your health full health in this timeline: childhood health, stress history, pregnancies, career changes, trauma, environmental exposures, lifestyle shifts, and because your body keeps score of everything. Then we review labs in depth of anything you have before imaging. And then if testing is already half done, we go through it line by line. If additional testing is needed, we choose it strategically, not excessively. And after that, you leave with a clear plan, not a 10 of random supplements. And we want to make sure who we need to referral in the right pathway: mental health, counseling, therapist, any psych, or any type of rheumatologist if you have any autoimmunity marker that was elevated, etc. So make sure we have a care team. And also work with your insurance or if you pay out of pocket costs. And a structure plan include what we're targeting, why we're targeting it, and what changed it first, what we monitor, what success look like for you. And follow-ups are intentional. We assess progress just based on data and make sure the plan evolves with you. What patients often tell me is, this is the first time someone actually connected all the dots. This is the first time someone actually listened to my stories. And that's the goal. Because when you understand your body, you stop feeling powerless. And when you feel powerless, you tend to choose food or make a choices that doesn't support your body that you may not understand. And now people will sabotage themselves in the cycle of eating more, gaining weight, feeling frustrated. They come to the doctor, a different diet. You hear that story a lot of times. And you start making decisions from clarity instead of confusion. And that changes everything. So a few clients stay with me, and a lot of people do stay with me, and also referral, which is a my blessing that I experience with a lot of clients. It's not because I run more tests, and a lot of people they can also say that too. It because they feel understood and supported in a way they haven't before. First, I treat the root causes, not reactions. We investigate what exactly going on in your body. If someone has anxiety, I'm not just asking about stress. I'm looking at cortisol rhythm, blood sugar stability, gut inflammation, micronutrients, and those relate to your lifestyle of what time do you eat in the morning? Do you skip your meal during the day? Do you tend to eat more and feel like you have to crave for food at nighttime? And if you do that, it's not because of willpower, but how your body is telling you because in menopause or andropause for men, we tend to lose that metabolic ability. So therefore we feel like we need to eat more because we're too busy with life, picking up kids, going to soccer, physical sport with the children, and we just take care of them. We pack every food. We forgot about ourselves. Therefore, we scramble, which is like going to the fast food place and pick up something to just fill up our gut. So we step back in the visit and wonder, is there another strategy we can prepare this and prevent any of those reactive experiences you have? So that is my goal for my client. And we identify what's driving the symptoms. Second, I practice both data driven and human centered medicine. We use lab when they are helpful, but we also listen deeply. Health isn't just numbers, it's patterns, lived experience, and context. Third, I understand the pressure of high performing people carry. And when we say high performing, your busy life, everyone is busy, no matter what job you do. You can own a company, employee for the company, you be a daughter, you be a son, take care of your parents who are aging, take care of your kids who are growing, be a teenager about to get out of the house, is feel overwhelming, even though some people have a good purpose in life and they love their job. It's just that heavy feeling. So what we do is we reorient and do things to support from the background, the foundation. So therefore, the order that we do, what we do matter to feed into how we feel. So that's the action leading to the feeling and the emotional. And entrepreneurs, leaders, caregivers, they often push through the symptoms. Raise your hand if you feel I'm pushing through it. The more I pushing through, I feel victorious because I overcome, right? And because stopping feel like feeling behind, falling behind, I work with that psychology, not against it. I understand how to feel. Get to this point is not easy. And you honor and you value what you have done and accomplished. Fourth, I bridge worlds of different specialty and different providers for you. I can collaborate with conventional providers, therapists, trainers, coaches, and protect referral relationships. If someone tell me, I don't want you to send a referral request because I want to protect that relationship, but I don't want to tell that I'm leaving that provider. Totally understand. That is your comfort zone. Truly understand. And I believe in integrated care, not competition. People are everywhere, always need help. And when we are out there to help individual, that's my blessing already of doing this work. And finally, I take prevention seriously. We don't wait for crisis. We want to prevent any healthcare costs down the road that we don't know about. And we build long-term strategy, especially around hormones, metabolic health, cognitive resilience, and energy capacity. When we get to a certain age, we always feel like, oh, we can't think sharply enough. Our memory become not as great, or our bone when we stand up, we feel not as good. We just have a harder time of feeling that lubrication for our joint. etc. So our job is to find out why and how to help you to get back on track and equip people make better decisions in every area of your life. Raise your hand if you feel agree with me. And why refer clients to us and to me? So um, when we think about refer to me when the client is high functioning but not well, and the entrepreneur or any high functioning performer who is exhausted but keeps pushing, and a woman who's lab or normal but she feels off, and the founders or any providers, any workers who struggle with brain fog, weight gain, sleep disruption, or mood shifts. The client who's seeing multiple providers but no one is connecting the dots, the person who wants prevention, not just prescriptions. And I work especially well with women navigating hormone changes, men in andropause stage, but also navigating that stamina, that fatigue uh, syndrome, business owner experience burned out, professional work with chronic stress, chronic gut or inflammatory issues, and individual dealing with complex or unresolved symptoms. And here's what important. I collaborate and I don't compete. And if you're a therapist, I support a physiology, so you work those deeper. If you're the trainer, I stabilize hormones and inflammation, so progress sticks. If you're a coach, I help regulate the nervous system so clarity improves. And my goal is to strengthen the ecosystem around your client, not disrupt it. So if you ever have someone who says, I've tried everything and I still don't feel right, that's when you send them to me and I will take care of them. So the option to work with me, there are plenty of ways. If something I share today resonates with you, and here are a few ways we can work together. First, I offer one-on-one integrated primary care. That includes comprehensive evaluation, advanced lab interpretation, hormone and metabolic support, gut health or optimization, and long-term prevention strategies. This is ideal for individuals who want structure, data-driven plan, and ongoing care. Stay with me because this next part will explain why your lab may not be normal. So second, I offer advanced lab consultation. We look at the normal lab and we find out what else that still drive your symptom. Some clients already have labs but don't fully understand them. I provide detailed interpretation and strategic next steps. And the third is I provide workplace and community wellness talk. If your organization, team, or network wants education around home health, hormone health, burnt out prevention, metabolic health, or stress physiology, I can design a section tailored to that audience. And in fact, tonight we have an event about the perimenopause and menopause at Montesano, a little away from Olympia. And next week we have another event for that perimenopause and menopause in Olympia, and also another event next week too for the Boss Society in Olympia that talk about wellness at the workplace. And fourth, I offer strategy sessions. These are focus clarity sessions for individuals who want to understand what driving their symptom and what direction to take next. And finally, I collaborate. That's a big thing. If you're a therapist, coach, fitness professional, and business consultant, and you want to create more integrated support system for your clients, I'm open to building those partnerships. So my approach is pretty simple. Sustainable health requires strategy, and I meet people wherever they are in that process. So if you're ready to understand what's driving your symptoms, I've included a link below where you can book a clarity session or learn more about working together. Thank you.